Questions about defendants' eligibility for diversions. More judges than not indicated that they have an effective non-incarceration program, which is positive. We felt that that was good. However, when controlling the population, 60% of judges from large jurisdictions have a successful program, while less than 30% of judges from smaller jurisdictions have an effective program. So you have some judges who believed effective programs happened, and then others that felt like they were not so effective. And what we've found out was that a lot of these programs that are out there don't have enough resources to actually conduct self-evaluations throughout the process. So it's difficult to really identify the effectiveness of certain programs based on the resources, based on their evaluation and the follow-up as well. And judges identify the importance of specialty courts, which show a positive correlation between effective nonviolent programs, non-incarceration programs, and specialty courts. And although many judges believe defendants charged with nonviolent crimes should be eligible for referral or treatment programs, more than 10%, and this was really interesting, more than 10% would allow assaultive offenses to be eligible for referral as well. We thought this was amazing because usually the norm has been that the only people eligible for with substance abuse problems who are eligible for referral should be only nonviolent. So that was a really interesting finding that we found. The other thing that we found is that regarding judges familiar with this article, which basically requires the release of mentally ill person into treatment, provided that the individual has been charged with or previously convicted of a violent offense. So the majority of judges knew of this article, but the majority of judges were like, we don't have the resources to properly apply this article. So it would be nice to have the resources to properly apply this article so we can actually do it. So that was something that we found. On the questions about options that would assist judges in effective addressing individuals charged with crimes related to substance abuse and mental illness, the vast majority of judges indicated the need for more funding, additional resources, and one of the judges, as you can see, even stated that we should be ashamed of the lack of services for these individuals, and it does not protect the community, and it does nothing to address the crimes committed. And these were basically specifically taken out of the free responses, which will be available, as I said earlier, to everybody about what all of the judges stated. One of the judges said the drug treatment is long-term, so we have to be realistic, right? So like long treatment is instrumental in most mental health issues, and we have to be able to monitor them locally in compliance, taking meds, staying clean, and being ready to intervene. Okay. So when we were asking about the assessment, when considering the chemical dependency and mental health, 90% of them, this was one of the questions that most of them agreed, is that it would be very helpful to know who they're dealing with, meaning, can we please have an assessment so we can know the severity of the mental health or the substance abuse problem. And many of them did have access to a licensed chemical dependency professional, but that varied based on jurisdiction. And we all know that there's a shortage of licensed chemical dependency professionals. So that wasn't much of a surprise. Although judges would find it early assessment of chemical dependency is beneficial, many judges do not receive the licensed chemical proficiency assessments until post-conviction and probation revocations for review. When we were asked to encounter, and we merged these so I wouldn't have to go and put you through all of the 25 different questions, which I sort of feel like I'm doing that to you, all of you right now. But judges' most prevalent complaint relates to the lack of treatment availability. This was more problematic in less populated jurisdictions. Over 87% claimed that this is an obstacle in jurisdictions having a population less than 50. So historically, certain counties have been under-resourced, and that still continues to be the case, which continues to tie the hands of judges when they're dealing with people with substance abuse and mental illness. And that there was a lack of confidence in certain programs. 25% of judges listed systematic issues related to processing offenders through the system. So, okay. So where do we stand right now? What we see is that there's a wide range of opportunities. I mean, judges are the ones who are so instrumental. I mean, I hear everybody coming together. I mean, this is like defense attorneys, prosecutors, district attorneys, judges. But there has to be also a component of service providers. There also has to be a component of individuals that are wanting to provide services. And so the opportunities is that there's a lot of collaborative efforts going around in each one of the counties. And I think that by letting them know of all of the different opportunities, like the task force is doing in specialty in pilot programs, like for example this one and so forth, there's a lot of ways that we can integrate solutions so that we can have real results. And quite frankly, we're not going to have many options. Obviously, we know that the diversions that were happening, that were given to the legislature, may not be there. A lot of the diversions that happened, that were allocated last session, were not being able to be implemented because, as I heard earlier in Marianne, was saying the devil's in the detail, right? So a lot of these diversions are still not online. There's a lot of safe Ps that were not online. There's a lot of different things that could have happened and didn't happen, and we may not have that money later on. So it is ultimately our responsibility as counties and as partners, advocacy groups, outside groups, people from the field to get together so that people with mental illness, people with substance abuse problems can get the adequate care, and so that we will stop this revolving door. And so this is basically the preliminary findings. This is going to be one of the two-part series. We're going to merge all of these results, and we are asking people for feedback. Because within the survey, we can take, if you have any specific questions, we can tailor a lot of the findings of the survey based on the questions that you have. So I hope this was useful. And I know giving survey results is not the most exciting presentation that we could expect, but we're really thankful for the task force to be able to give us this opportunity to partner with them, and for all the judges who responded. Any questions? No? Okay. Thank you very much.